when we talk about poverty, in most situations, we only take into consideration able-bodied individuals. It almost seems as if our fellow Filipinos who live with disabilities are treated as just statistics, as just numbers. Being poor as an able-bodied individual is hard enough. What more for our fellow Filipinos in poverty and living with disability, specifically blindness?
Before we get to the bottom of things, let us first define blindness. Blindness refers to the loss of vision or the inability to see anything, including light. It can be temporary or permanent. Blindness may be caused by damage to any portion of the eye, the optic nerve, or the area of the brain responsible for vision. Or it may be a symptom or an effect of an existing health problem, disease, or illness. Last 2004, the Philippine Eye Research Institute conducted the National Survey on Blindness. Their studies show that blindness among 50 years or older has a crude prevalence of 4.62% in the country. It affects 270,000 elderly Filipinos primarily due to errors of refraction and cataract. In 2017, the estimated number of people who are bilaterally blind is 332,150.
Blindness, when left unaddressed, results in reduced functional ability and loss of self-esteem, and contributes towards the reduction of quality of life. The disability from visual impairment has considerable economic implications, with loss of productivity and income, and can lead to poverty and social dependency.
So how does the government address the prevalence of blindness in the country? The Philippine government provides services to address blindness through the following agencies. First, the Department of Social Welfare and Development, or DSWD, which meets the needs of the poor, vulnerable, and disadvantaged through programs on social protection and poverty reduction. And second, the Department of Health, or DOH, which manages the country's health system primarily through policy planning and development. Under DOH is the Degenerative Disease Office, or DDO, and one of its programs is the National Prevention of Blindness Program. Some of the services available in the Philippines to address blindness are eye checkups or consultations, medical and surgical operation, and rehabilitation. For those who are legally blind, they are given PWD IDs, while senior citizens are given their own identification cards. Both groups receive benefits and privileges, such as discounts in public facilities. And to further promote quality eye care in the country, the government issued Proclamation Number 40, declaring the month of August as Sight Saving Month.
Now, despite the presence of programs implemented by the government to help address the issue, there are still a lot of cases of blindness among the poor. What contributes to the continuing problem of blindness in the poor? What are the barriers that prevent the poor from accessing the help that they need? Research reveals that the biggest barrier facing blind and partially sighted people is the lack of knowledge and understanding of sight loss and outdated attitudes of the people around them. A poll of the general public backed up the charity's research, finding that 50% of people think that someone with sight loss would struggle to hold down a job, and nearly half, or 44%, admitting that they would not always help a blind or partially sighted person. As we can see here, the lack of access to proper health education and cultural factors serve as barriers to high quality of life for blind people. Because of the lack of access to health education, people tend to not seek healthcare, especially for preventive reasons. Certain conditions may develop without them knowing, and before they even notice it, their condition might have already worsened. As said before, blindness is not just a congenital condition. Some cases of blindness are effects of primary conditions, such as diabetes. Adding to these factors are the poor living conditions by poor people, the lack of access to better food choices, sanitary water supply, and clean air, among others, have an effect on the health of a person. These factors may not directly cause blindness, but certain conditions that can develop due to these poor living conditions may contribute to the development of blindness in the poor. We can see that there is an interconnectivity in these factors: lack of access to healthcare and health education, poor living conditions, and cultural beliefs. The results of a study conducted by Karami Nihat et al. Said that providing education, providing employment, improving and expanding social programs for the blind and individuals with low vision, especially women, are necessary. With this being said, it can be seen that the provision of social services would largely help in increasing the quality of life of blind people. Our fellow Filipinos with blindness may not be able to see the light, but they serve as our light to these issues faced by them. Now that that light has been shed on us, we must do our part in furthering our call.